as the room populates. We have a very robust agenda this morning. So my name is Lynn Allen Sion, and I want to welcome everybody to our January monthly meeting. We can't call it a breakfast anymore because we're not feeding any of you. So we just call it our monthly meeting. And today we're going to be talking about the vaccine, because there's a lot of questions about the safety of it, the efficacy of it, the distribution, is it available, who is it available to? So we're going to be going through all of that. And we have some really wonderful, wonderful, brilliant people who work with this. So we're very grateful for that. I do want to just let everybody know that the sponsors for this morning's breakfast are our speakers. So it is Orange County, Cornerstone Family Healthcare, Toro Medical College, and I want to thank you, and HR Visions HR. So I want to thank everybody for sponsoring this and being part of this this membership meeting this morning. There will be questions and answers. You can use the chat room for your questions. I will be monitoring that, and at the end of the presentation, we'll be going over the questions. I think that was really all that I wanted to let you know. I do want to just let you know, as members of the Orange County Chamber, there's a couple of initiatives that we're working on right now that have nothing to do with the vaccine. The big one is the unemployment premium that may be raised because of the amount of unemployment that was given out, unemployment insurance that was given out last year. So I do want to let you know that it's our understanding that that may be being brought to the Senate floor next week. Once we find out more, that information will be put in our Monday newsletter. So please check your email boxes on Mondays, of course on Monday, Wednesday, and Friday, but all the legislative information, all the information that we get about the vaccine, anything that has to do with rules, regulations, news, that's in the Monday newsletter, and that goes out in the afternoon. So please make sure that that you check your email box. It has a very good open rate, very good click-through rate. We have all the links in there for you to be able to get the information, for you to be able to access the different funding. All the PPP information is in there, the Barstool funding information, the Restaurant Recovery Act, and those applications are in the Monday newsletter. So with all of that, I don't know if Steve Newhouse, I don't see Steve. Steve, are you in there? Did you pop in yet? Nope, okay. So we have, for our panel today, I want to thank Dr. Ken Steyer, who is the Dean of Toro College of Osteopathic Medicine in Middletown, will be our moderator. Dr. Mrna Gelman, who is the Health Commissioner for Orange County. She is one of our speakers on the panel. Dr. Avi Silber, Chief Medical Officer for Cornerstone Family Healthcare, is another speaker, and Janet Gianetta, who is the principal for Visions HR, is also on the panel, and she'll be talking about some of the HR considerations that employers are facing. So with that, I'm going to turn this on. I want to thank all of you for being on the panel. I so appreciate working with you. I appreciate your expertise and your wisdom, and I know that you'll be answering a lot of questions and bringing us the facts about the vaccine, which is why we're doing this, because we want facts, we don't want politics, we want the actual truth. So with that, Dr. Steyer, I'm going to turn it over to you.
Okay. Good morning, everybody. Nice to see so many familiar faces and members of the Chamber of Commerce. I'll be your moderator today, so I will guide at least the initial part of the conversation, and then we'll have time for questions at the end, of course, and there's so much material to cover. My background is I'm the Dean at the Toro Medical College here at the old Horton Hospital in Middletown. We've been here since 2014, and the school's doing great, 135 students per class, so 540 students, 80 master's students, doing great with our many partners for training: Cornerstone Healthcare, Garnet Medical Center, St. Luke's Newburgh, Vassar Brothers, and several others. My background is I'm a pulmonary and critical care fellowship trained physician. I also have a master's in public health and did 4 years of public health service. I got my vaccine last week, and it's nice to be here. And I'd like to introduce our panelists. Our first panelist that I'd like to introduce is Dr. Mrna Gelman, the Orange County Health Commissioner. Dr. Gelman.
Good morning, everyone. Thank you very much for joining us this morning. I wish my camera would have worked just like it has during the testing stages, but unfortunately, Murphy's Law. kicked in, but I am with you in spirit and in audio only. Hopefully, I believe it says the host can start the video, but for some reason it's not working on my end, so I apologize for that. I think to set the background for where we are first with the pandemic and the numbers, and then as far as the vaccine rollout, to date, as of yesterday, we've had 27,160 confirmed cases of COVID-19 in Orange County from the beginning of the pandemic in March. That's an increase of 373 cases since we last reported that number the day prior to that. We have unfortunately had 638 deaths from the beginning of the pandemic, and these are COVID-19 deaths. So these are individuals that have died that tested positive for COVID-19. So these are lab confirmed certified deaths. In terms of where we are in the 10-day rolling average for daily new positive cases, we are seeing approximately 298.5, which is very close to 300 cases on average new daily. This is the highest we have seen since the first wave in April. We also currently have approximately 2,960, so close to 3,000 active cases. And of course, this is a factor of post-holiday travel, gatherings, so on and so forth. So we're clearly seeing an influx of new cases. In terms of deaths, and to put the 638 deaths in perspective, that puts us with a population of approximately 385,000 people in Orange County. That's about 1 in 600 people in Orange County that have died of COVID in the past year. I know there's a lot of conversation in relation to COVID and the flu. So a very rapid comparison. I know we received the question, are we testing for flu currently, or is everything quote unquote COVID? Yes, we are testing for the flu nationwide, statewide, and within the county. As of October 3rd, so from October 3rd until today, present day, and of course this has been a complete week and the flu are reported weekly, we have tested 15,644 residents of Orange County for the flu, and 24 residents tested positive for the flu from October 3rd until January 12th. So it's a clear indicator that obviously flu vaccination is working because we have seen an increase in flu vaccination across the county, which is a great metric to report. But clearly flu vaccination along with masking and social distancing are working to slow the spread both of COVID-19 as well as the flu numbers. In terms of comparison, same year, so all other years we see roughly for the same time period of about 14 weeks that I mentioned, we see on average 2,000 to 2,500 confirmed positive flu cases. And as I mentioned, currently we have seen 24. So I hope that clarifies some of the misconception regarding flu versus COVID. And I won't get into the general metrics. I think I've mentioned them before. Nationwide statistics for the flu annually, we see on average 50 million cases all other years. Obviously with hospitalization complication rates for the flu being at 0.01%, so on average 500,000 nationally, and deaths being at 0.001% versus COVID-19, where we're seeing hospitalizations at 14% and the complication rate of total positive cases, and deaths at around that 2 to 4% mortality. We're averaging about 3% mortality from the total amount of cases. So just roughly where we are in terms of statistics overall of cases seen to date, approximately 79% of deaths that we are seeing are in individuals 65 and over, but that's not to say that we have not seen a death. I think I mentioned it yesterday that we have unfortunately seen recently an individual in their mid-20s be discharged from the hospital, die a day later in home. We have seen a number of siblings in their mid-20s, no comorbidities, no history of vaping, smoking, die as well. And overall, from the beginning of the pandemic until December 30th, we have seen 22 individuals in Orange County, age 18 to 44. So that's 4% of our total deaths until December 30th, which is an N number of 564 total for this statistical data set. 22 individuals ages 18 to 44, 98 individuals, which is 17% of total deaths, age category 45 to 64, 122 individuals 65 to 74, and 322 individuals 75 and over. Now, with that statistic that I reported, what's important to note is the 65 and over demographic is approximately 15% of our total active COVID-19 cases. So 15% of total active cases are individuals 65 and over. To be specific, 65 to 74, 8%, and 75 and over, 7%. However, as I just mentioned, the mortality disproportionately impacts individuals 65 and over. So 79% of individuals that have died were 65 and over. So clearly, this disproportionately impacts our older population, and that's as far as complications and mortality is concerned. So that's just a statistical overview of what we are seeing. In terms of COVID-19, as I mentioned, about 3% in general of all positive cases have died. 14% are hospitalized or develop complications. And as it's widely noted, around 80 or a little over 80% will recover. And of course, long-term complications still remain unknown. A few general questions in terms of vaccine. So vaccination, obviously we're starting the new year with vaccine that is available. The current vaccines that have been emergency use authorized by the FDA are the mRNA vaccines, and Dr. Silber will go into more detail on the vaccination and the safety. But in general, what are we seeing in terms of who is eligible? And before we kind of get into the criteria that has been broadly publicized, clearly the criteria is the recommendations themselves, the prioritization, if you will, is made by the CDC on the national level. And they do work together with the Advisory Committee on Immunization Practices as far as recommendations are concerned. And those are adopted by the New York State Department of Health. And each state can utilize those guidelines as they best see fit. And keep in mind that, of course, eligibility for vaccination and prioritization for vaccination is dependent on risk, of course. And as I mentioned just now with statistics that we're seeing both locally, statewide, and nationally, we're clearly seeing that this disease disproportionately, this virus disproportionately impacts our older population. So the question begs to be asked, why are we not prioritizing seniors first and foremost and before everyone else? So in order to really answer that, and of course that's a question best posed for the CDC and the New York State Department of Health. However, just to shed some light on it and some insight, that risk is not just the risk to the population that is most susceptible, most vulnerable, and medically fragile. It also takes into consideration the risk that you as an individual pose to population health and others. And that's where we can clearly see that persons that are frontline workers, emergency responders, doctors, individuals on the front line that may be exposed or are at a greater risk of being exposed to COVID-19, and then thereby passing that COVID-19 to others, are prioritized simply because of the potential of the propagation of disease and the disease spread. So there are two variables as far as eligibility to keep in mind for 1A and 1B for the phases that we're seeing in the tiers. It's how vulnerable and susceptible are you, and how likely are you to be the spread or the vector, if you may, of potential propagation of that disease to others. So that's where we're seeing healthcare workers. Phase 1A includes healthcare workers, currently high-risk hospital workers, emergency room workers, ICU staff, federally qualified health center employees, emergency medical services workers, coroners, medical examiners, funeral workers, urgent care providers, people administering COVID-19 vaccine, including local health department staff, all outpatient, ambulatory, frontline, high-risk healthcare workers of any age who provide direct in-person patient care. Again, that component of potential exposure to others and impact on population health. So all staff who are in direct contact with patients, such as reception staff, all frontline high-risk public health workers who have direct contact with patients, including those conducting COVID-19 tests, handling COVID-19 specimens, and COVID-19 vaccinations. This includes, but is not limited to, doctors who work in private medical practices, their staff, doctors who work in hospital-affiliated medical practices and their staff, doctors who work in public health clinics and their staff, registered nurses, specialty medical practices of all types, dentists and orthodontists, their staff, psychiatrists, psychologists, physical therapists, optometrists, pharmacists, pharmacist aides, home care workers, hospice workers, and the list goes on. Of course, residents and staff in certain group living facilities, so those congregate settings, which we have seen, again, be disproportionately impacted by the propagation of disease. Nursing homes, New York State Office of Mental Health, Office of People for Developmental Disabilities, Office of Addiction Services and Supports Facilities, Corrections Department, and the list goes on for now to include P through 12 schools, college and childcare, public transit, and each one of those obviously have a list, a bullet point list, homeless shelters, other residential programs and supporting housing. And now this 1A has also had the next eligible group added for 1B as well. So we are currently in phase 1A and 1B of who is authorized to receive vaccine. And not that I want to introduce an early warning arithmetic problem, but currently New York State, with allowing 1A and 1B to receive vaccination, has qualified 7 million residents in New York State under 1A and 1B. However, as we have all seen, the vaccine allocation to New York State from the federal government, and I'll get into the next question, how is the vaccine distributed? So the vaccine is obviously distributed from manufacturer to the federal government, and from the federal government, that is then allocated per state. It goes from the New York State Department of Health to our regional hubs, and these are regional hubs that were designated by the New York State. And for us, the regional hub, and by us, I mean Orange County, Westchester, Putnam, Dutchess, Rockland, and Ulster, the leader of our local hub is Westchester Medical Center. And they essentially provide, they are the conduit to the allocation from the New York State Department of Health to all authorized, quote unquote, providers. And the providers that have been currently authorized in Orange County are our 4 hospitals, our 1 FQHC being Cornerstone, and our local health department. We are currently having 3 pharmacies come online. And if you check that eligibility tool, which I will discuss in a few moments, it will steer you in the direction of all eligible providers. Please keep in mind that the New York State Department of Health not only dictates the rollout, but also controls the allocation and administration of vaccine. So not only does every individual have to adhere to that qualifying tier and actually be qualified and affirmed to that fact, but every provider has very stringent guidelines as to who they are allowed to vaccinate and at what times, certainly. That system that came out, so New York State Department of Health has an emergency preparedness system, which is the CDMS system, and that is an online system for actually registering individuals for appointments and ensuring that they're registering with certain providers. Now, we have the luxury of controlling our own registration in that system because we have been amply trained, and by we, I mean the local health departments, specifically in that system for obviously mass vaccination and pandemic response, for POD, which is point of distribution or point of dispensing of countermeasures, as it may be, medical countermeasures. And our system is the CDMS system. Keep in mind, a lot of the providers that were tasked with this rollout were not historically trained in this system. And the New York State Department of Health has reserved the right to actually schedule all of those appointments. And the fact that we do not have a residency requirement for vaccination makes it so that once the New York State Department of Health opens up that registration via those links, they essentially control the registration, cancellation of appointments, so on and so forth, for a lot of our local providers. And that's what you have been hearing, a remnant of that fact, where local providers may not be, quote unquote, vaccinating or pushing out vaccine at an increased rate. It's not that the vaccine is standing there collecting dust. It is a factor of the way the rollout has been very meticulously controlled depending on provider. So going back to our Common Core math problem, we have 7 million qualifying individuals in New York State under 1A and 1B, with approximately 300,000 doses allocated to New York State. However, keep in mind, Moderna and Pfizer are both 2-dose administrations. So out of that 300,000, a little more than half currently will be designated and held back by New York State to ensure that secondary dose administration. So if we divide that, that leaves us with approximately, give or take, 120,000 doses statewide weekly, and that's if the federal government continues this rate of allocation. Again, going against that 7 million qualifying individuals under 1A and 1B, creating a clear issue of supply and demand, and of course demand currently at this time really exceeding supply that we're seeing. What does that mean for Orange County? And I'll be quick with this because I do want Dr. Silber to really get into the vaccine efficacy and safety and implications on the clinical medical levels. The Orange County population, as I mentioned, 385,000 estimated. If we are to extrapolate those 1A and 1B criteria and really apply just the statistical total New York State population versus our population, it qualifies approximately 135,000 of our local residents to receive vaccine under 1A, 1B. Keep in mind, there's no residency requirement. Everyone can go anywhere within the state, so that's also a factor. So if we have 135, give or take, approximately residents qualifying under 1A, 1B, our projected vaccine allocation per county weekly for all of our providers that I just mentioned, 4 hospitals, 1 FQHC, 1 local health department, and 3 pharmacies currently that have not received vaccine but are promising to get it sometime this week. So for all of those providers, the vaccine allocation, because it is allocated per population size, promises to be approximately 2,300 doses. So 2,300, again, new doses. These are first vaccines that we're talking about because that secondary dose is reserved for anyone that has received that first dose. So we have about 135,000 residents that qualify under 1A, 1B, with approximately anticipated 2,300 doses of vaccine to be received weekly if the rate of allocation of vaccine and availability of vaccine remains the same. So clearly that, even without Common Core, poses quite the supply demand issue at this time. And the New York State Department has posted an emergency notification on their website stating that very same fact, with 7 million qualifying individuals, 300,000 that they're receiving, of course, broken up into first and then guaranteed second dose, and them not having availability for appointments for the next 14 weeks out. So, of course, current rate of rollout is an issue. It's most definitely of concern because at this rate of vaccination, it will take years to vaccinate the population that we need to be vaccinated in order to reach herd immunity. So on the population health end, we've all heard in order to reach herd immunity, we need approximately 80, give or take, % of our total population to be vaccinated. I know I have been quoted before with saying that 22% of our national population is pediatric. Currently, there is no pediatric authorization, not because the vaccine causes issue in pediatric populations, but simply because the phase 3 clinical trials have not been completed. I understand the Pfizer vaccine is authorized for individuals 16 and up. However, Moderna is for individuals 18 and up, and Pfizer is in phase 3 clinical trials for that 12 to 18 category currently. Moderna has not started their phase 3 clinical trials for that pediatric population just as yet. So if we are to subtract, again, that 22% nationwide of pediatric individuals 18 and under, again, we can all do that simple math, reaching that approximately 80% herd immunity of the total population would dictate that we would need to vaccinate majority, if not all, of our adult population. In terms of overall compliance that we were seeing again nationally, compliance with masking has been at about half, so about 46% mask compliance. Preliminary surveys for vaccination have also shown about an equal distribution of about half of our population anticipating being vaccinated. So obviously with vaccine hesitancy presenting a tremendous issue in terms of reaching that herd immunity goal, we have quite the battle ahead of us. In terms of immunization in general, and I will leave kind of the details and the glory to Dr. Silber in terms of vaccine safety and efficacy, but vaccination really, if we are to think about it in the rudimentary aspect, we're fighting this war with COVID. It is a long-term war. This is not a short-term situation. We've clearly been at it for close to a year. Similar to any war, we need to be well armed and prepared, and that's precisely what vaccination allows for us to do. Our vaccines 100% effective. There is no one medical countermeasure that will be 100% effective in all individuals. Clearly, physiologically, we're all very different. However, if there are no medical contraindications for actually receiving that vaccine, definitely speak with your medical provider about obtaining it and receiving it when it is available, because it does arm your body to actually fight off that invader, if we are to think of this virus as an invader. And it really does give you the extra weapons and the arsenal to really fight it off when you are presented with that virus. And clearly we have broad community acquired transmission at this time, as I mentioned, statistically speaking. So that in a nutshell is where we are with vaccination. So the vaccine goes from the CDC to New York State Department of Health, and from the New York State Department of Health to our regional hub, where it is then allocated to the providers that I have mentioned. If someone is eligible, what is the process to be vaccinated, and where did they go? A number of individuals that were initially, when this was rolled out on a very small, kind of narrow level of authorization under 1A, there were links that were active that were sent out to subsets of the population that were authorized to receive the vaccine. All of the different providers that I've mentioned, so hospitals were tasked with, of course, medical providers and really concentrating on our emergency responders, so EMS, our medical examiners, and our coroners. The FQHCs were tasked with the O's that I have mentioned: Office for the Aging, Office of Mental Health, Office for Mental Health, and OASIS. Not to say that those are the only individuals that can get vaccinated. As long as you qualify under 1A, 1B, you can get vaccinated anywhere where vaccine is available, both within the New York State, because there's no residency requirement, or at any provider. However, for the most part, those providers were tasked by New York State Department of Health with a certain subset of the population. So they tried to address those segments. Pharmacies were predominantly tasked with individuals at this point 65 and over. So why is the vaccine not readily available for all eligible individuals? I think we've addressed that. It's really a component of manufacturing and supply and availability to both the federal, state, and local providers. Is the vaccine being thrown out? Absolutely not. Anytime that we are hearing accounts, I will say that Pfizer has a very complicated cold chain, meaning that it has to be stored, as we heard, at very low temperatures. That poses an issue not only with cold storage and the chain, because obviously it's being delivered, it has to be stored accurately, and we're tracking that as it goes along, but also it has to be, quote unquote, thawed out, not a clinical term, very gradually and at very specific increments. And it does use a diluent. So that dilution is very important, because it's not kind of out of the vial as it is with Mrna. So there's a bit more operator dependent error there. And that's the accounts that we have been hearing about, with CVS handling vaccination in nursing homes, and that's a federal program, of course, with CVS and Walgreens being the tasked by federal government providers with rolling out vaccine to nursing home residents. But vaccine is most certainly not being thrown out. As I mentioned, there were quite a few restrictions early on hospitals, FQHCs, local health departments with who they can vaccinate, at what increments they can vaccinate them, so on and so forth. Why do only certain providers that have the vaccine to administer? I will say this much, those were the providers, again, determined by the New York State Department of Health and the CDC, that were best equipped at the time to handle the initial rollout, of course, with hospitals having that medical staff and having access to emergency responders, and some of the other providers having access to their segments of the population that they were tasked with vaccinating. Also, early on, Pfizer was the only available vaccine, and it was imperative to have proper storage units for it. So some providers were selected early on based on those factors. But in terms of providers having vaccine, they were just better equipped to handle that mass vaccination aspect and population health considerations. I will say this much, that factor of rollout and not having enough vaccine available clearly is the major driving force for providers, even the ones that are authorized to vaccinate, just simply not having vaccine at this point. Do I have to be vaccinated in Orange County? Can I get it in another area? I think we've addressed that. You can and should get the vaccine anywhere that there is access to get that vaccine. And one very quick point of reference, we have been receiving hundreds, if not thousands, of phone calls at this point for vaccination. The best strategy at this point with the current structure of vaccine rollout is to go on the New York State Department of Health website, click on the Am I Eligible tool, fill that out. It will not only tell you if you're eligible, but if you are eligible, please put in the widest radius of where you're willing to travel. I believe it's 100 miles. And within 100 miles of this epicenter of Orange County, there are approximately 50 providers at this time, including a state-run facility in Westchester, that if they have vaccine and appointments available, you will be registered at that tool. So please just go provider by provider and see if appointments are available. As a backup, there are two numbers for the New York State vaccine hotline and a general number. The vaccine hotline number is 833-697-4829. They have notified us that once they have 10,000 individuals in queue at the same time, there will be an automated message that will go on, so try them back. And that, I think, gives you insight into the scope of volume of calls that they're seeing. And the general number for the New York State Department of Health coronavirus is 888-364-3065. Now, in terms of locally, any individual over the age of 65 or 75 that's not necessarily computer literate, for Orange County, if you know of individuals that do qualify but are not computer literate, they're welcome to call our Office for the Aging. They will not only walk them through it, they will actually physically register them. That number is 845-615-3700. So I will stop there for now because otherwise I'll go on for hours, and I would love for my colleagues to have an opportunity to discuss the important matter, which is the vaccine efficacy and safety. Thank you.
Thank you very much, Dr. Gelman, for that very comprehensive review. And I guess we'll try to send those phone numbers out later on to anybody who might have missed them. And there will be a quiz at the end of this session on all the statistics that Dr. Gelman covered. So please refer to your note. It can be open book test if you like. That might help. So our next speaker, Dr. Alvi Silber. I'll let Dr. Silber introduce himself, and Dr. Silber is going to talk about the vaccine efficacy and safety and some of the specific administration issues related to should I get the vaccine or not get the vaccine. So, Dr. Silber.
Yeah, hi, Dr. Silber. I'm the Chief Medical Officer at Cornerstone. We're primary care provider here in Orange County, about 50,000 patients. And we've been seeing the other 84% of the patients that aren't hospitalized since the beginning. And as a pediatrician, a still active pediatrician, vaccines are really kind of close to what I do, and I talk to parents all the time about it, and something we really kind of, we support and seen a lot of efficacy over the time. In general, I mean, as a pediatrician, it's not just polio that we've seen go away or measles, but even when I did residency 25 years ago, there were a lot more meningitis on the floor and severe illnesses, and we've had vaccines that have stopped patients from getting ill, Prevnar and Haemophilus influenza. So we see it works. So a lot of people, I think, have become mini microbiologists and scientists by reading the papers. But just to start from the beginning, just really basic. What happens when you get infected with a disease, a virus like COVID, is your body will produce an immune response to fight the infection. But it takes about 2 weeks for that infection, for your body to ramp up the immunity. So in that time, you could get very sick from the virus. So what vaccines in the most basic terms do is it fools your body into preparing this immune response without getting sick. So if you actually do get exposed to the virus, your body is ready to fight this infection right away rather than waiting 2 weeks. So that's how vaccines work. And that's, if we get sick, we develop immunity, but we develop immunity 2 weeks later, so we've already had the damage done by the infection. But if we get the vaccine, as soon as we get it, we're ready, like if we say that army of immune system that's ready to fight the infection. So different types of vaccines that have been out there, the most traditional one, things like the measles or the flu, is they take this virus and they make it less strong, so it doesn't cause disease, and they give you the vaccine, and your body doesn't get sick from this virus, but it creates an immune response and is able to fight the infection. So that's the most traditional basic one we have. So it's still the virus injected, but it's weakened and it won't cause a problem. We also sometimes take a piece of that virus, we call it an antigen or a protein, and those are another type of vaccine, and we put it on other weakened viruses that we get into the body somehow, and we give that as a vaccine, and that again makes our body prepare the immune system for it. Traditionally, those viruses need to be grown in some kind of like chicken embryo cells and whatnot, and it takes a long time to make. Now, what we've all heard about, this mRNA vaccine, we don't inject any virus, there's no live virus, there's no anything in there. What it is a piece of RNA, which is really just a blueprint. It's instructions for your own body to actually make a protein, something that tells the body that you need to create an immune response against the COVID vaccine. So there's no COVID vaccine being injected. There's no other viruses being injected. It's just a little piece of instruction that tells your body what to do, and a little piece of fat that helps it get into the body. And after a few hours or a day or so, that goes away. And all it's done is the only thing that would happen is your body has now created this protein, which helps your immune response be prepared in case you get shown or infected for the COVID vaccine. And that's the real basics. So I too, back in March, when I heard we're going to rolling out a vaccine in such a quick time, said, how are they going to roll it out so long? Because I've always known vaccines take 10 or 20 years to create. But really, this technology has been around for 20, 30 years. We were prepared to make this vaccine for the MERS and the SARS back in 2002 and 2013. So it was ready to go. So the actual vaccine was created in like 6 weeks, 7 weeks, but the technology was there. But really they rolled it out quickly. They've done all the safety steps that you needed to make sure that the vaccine is safe. They've went through all the different phases that every vaccine does, but we just did it a lot more efficiently. So normally a vaccine has to go through a phase 1 where they make sure in a small group, there's not terrible side effects. Then in phase 2, they make a bigger group, they check side effects and check a little bit more if it works. And then phase 3, where they include, in this case, they included about 30,000 people, they check it in a larger group of people, continue to check safety, and also make sure it works. So what they were able to do is instead of waiting a lot of time between these phases, they ran them a little bit with an overlap, and were able to get through that same safety process, quicker. And also the other thing is the reason why we couldn't test these viruses before the SARS and the MERS is because the disease has to be prevalent in society in order to make sure it works. So if I have a disease and I'm testing a medicine, I could say 100 people have this disease. I gave a medicine, and how many people got better? But when you give the vaccine, you have to give a large population the vaccine and then see how many of them actually get sick. So there has to be a lot of people with the disease in the population to get it. So this all set us up to have this process be tested really quickly. So what we were able to see this fall, and this is where we get into the efficacy, is the Moderna and the Pfizer. They looked at 30,000 people, and they gave 15,000 people the vaccine, and they gave 15,000 people the placebo. And they said, go out into the world and live your life, and let's see how many people would get COVID. And that's how they figured out. Now, the fact that COVID is so prevalent, they were able to get to the point where they could prove it worked or didn't work really quickly. So in the case of Moderna, they found about 200 people got COVID. Out of those 200 people, it's really 197. Out of those cases, 186 of them were in the placebo group. That meant that if you didn't get the vaccine, and 11 people in the vaccine group got COVID. So that means if you didn't get the vaccine, if you got COVID, 95% chance you didn't get the vaccine. So 95% protection from getting the disease if you got the vaccine. Then they looked further and they said, okay, some people end up in the hospital, some people end up with severe disease, and that's what we really care about. And out of the 30 people out of that group that actually got severe disease, none of them had the vaccine. So we know that that's what we say the efficacy of the vaccine is 95% effective against COVID. So 95% chance from this group of 30,000 people that you won't get COVID, and 100% that you won't get severe COVID. This is out of 30,000 people. So that's how vaccines work. Out of these 30,000 people, we didn't see any serious side effects. The side effects that were seen were side effects that were expected. Like maybe some low-grade fever, maybe some muscle aches, some fatigue, definitely like a punch in the arm that you would feel. And this is just a sign that your immune system, which is creating that protection, is starting to rev up. We saw more in the second dose and the first dose because when you're shown the second time, when you get the second shot, you're more likely to have more of an immune response. And when you see reports that 80, 90% of the people had some kind of side effect, that is any side effect. So I just wanted to kind of play with those numbers a little bit. I got the vaccine, and yeah, it felt like an achiness in the arm. So I'm counted as a side effect. But when they looked at the different stages, grade 1, grade 2, grade 3, how bad side effects were, it was really only, you saw more in the second shot, you saw more with younger people, that only 5 to 10% of the people had enough of this side effect that it affected their life, which meant that they had to take a day off from work, or they weren't feeling well, and they couldn't go about their daily activities, and that was short-lived. It was just about 1 or 2 days. So really, the side effects are a lot lower. So it's definitely been proven to be safe, and this is in the group of 30,000. Now, as we roll it out, and as Dr. Gelman said, we're looking at about 300,000 doses given in New York alone. So we're seeing this in about 20 times the amount of people every week here in New York. So we aren't seeing anything else besides the regular side effects that we looked at right now in a lot more of the people getting the dosage, the fatigue, the pain, the muscle aches. And I definitely want to leave some time at the end because I want to know what people are asking or what concerns them about the vaccine. I think, if you look at one of the earlier concerns that we saw in the news media was for allergies, severe allergic reactions. again, as a pediatrician, I give out amoxicillin or penicillin all the time for ear infections or strep throat and things like that. Amoxicillin itself has about a 1 in 20,000 to 1 in 40,000 chance of a severe allergic reaction. So we're looking at the vaccine, it was 1 in 30,000 in the studies, and now we're not seeing a lot of serious allergic reactions in 1 in 300,000, in 300,000 a week. And in vaccines in general, are like 1 in a million actually for severe allergic reactions. So once again, as we start seeing 300,000 people in New York getting the vaccine, you might hear individual reports of reactions, but really it's not more than you would generally see in general population or in giving my amoxicillin, which is more of an incidence, which I never hear people saying, don't give me amoxicillin, I'm afraid of allergic reactions. So it's really being very safe. The side effects are mild and they're short-lived. Some of the other questions that were already posed to me beforehand to talk about is I can't believe it. Are they injecting microchips into me? Really, I looked at that, and the reason why that came about is there are codes on the actual vials that help us track the vaccine, but really the vaccine is very simple. It is the mRNA, which degrades, and the fat envelope that helps it get into your body, and which also degrades after a day. In most vaccines need a booster dose. We need 2 doses. After the first dose, you would only get about 50% of the people that are protected against disease. So really to get to that 95%, you need a second dose, and then you need a couple of weeks after that dose for your immune system to respond. So we can't really stop at 1 dose. We need, we want to get to the 2 dose to feel that we're fully protected. Although, even if we were only allowed to give 1 dose, you would still be cutting in half the amount of COVID out there, which would help in general. Children are different. The studies were specifically looking at adults. They weren't included in the studies. Children's immune systems are a lot more robust, so it's going to take a little time to get to them. They're going to go backwards, the 12 to 18 and then the younger ones, and it's going to take a little time because they have to lower the doses and study that coming up. But, fortunately, the younger children have definitely been spared the worst of this vaccine for now, but I don't see them coming on board for a while because the studies just need to take their time. As far as contraindications and reasons I shouldn't get the vaccine, there is no contraindication to getting the vaccine except for a serious allergic reaction to the vaccine if you got the first dose or one of the components of the vaccine, meaning you had severe allergic reaction that needed EpiPen, you had to go to the hospital. So if you have food allergies, even if they're severe food allergies, peanut allergies, hay fever, an allergy to penicillin, these are not reasons not to get the vaccine. If you have a history of severe allergic reactions, the recommendation is to watch you for 30 minutes because if we're going to see a bad side effect, we'll see it in the first 30 minutes almost all the time. If you have an allergic reaction to an injectable medicine, another vaccine, also that's a precaution and something you should talk about with your doctor, not necessarily a contraindication to anything. Other things, I just talking about my staff who ask me questions that are concerned. Should pregnant women get the vaccine? Should, women who are lactating get the vaccine? They've talked, once again, they didn't include enough pregnant women in the studies to make a definitive recommendation, but ACOG, the American College of OBGYN, and a lot of experts say, one, there's no reason to think that this would have any issue with pregnant women or lactating women, and we do recommend they're offered the vaccine. There is reports that actually getting COVID while you're pregnant could actually lead to preterm labor, complications of pregnancy. So those are actually reasons to say if you are thinking about getting pregnant, you want to protect yourself from getting COVID because the vaccine is the one thing that can actually help you protect against COVID. Once you have the baby, you can actually, transmit some of your protection over to them as well. So I'm always telling that to my patient. You're protecting your baby as well. And it's something, you want to talk about with your doctor, because especially if you're out there, if you're an essential worker and you're going to be pregnant, you have a higher risk against COVID. That's certainly a reason to get the COVID vaccine. So you can get the vaccine if you're lactating, if you're breastfeeding, if you're pregnant, if you had one, and I'll stop because I'd rather kind of get the questions and see what's on everyone's mind. Should I get the vaccine if I've already had COVID? Absolutely, because we're not sure at this point how long the protection from the disease actually lasts. We do know that it's pretty rare to get the COVID again within the first 90 days of becoming sick. So if you want, you could put that off for 90 days, but they do recommend COVID vaccination for patients who had COVID previously. The only contraindication is if you're currently sick with COVID, you wait that full 10 days till afterwards, so you don't put the people vaccinating at risk. So that's a general overview, and I'd love to kind of, I love talking about this. So even if we don't get to your questions today, definitely reach out to me. It helps me when I know the questions out in public of what people's hesitancy are. I like talking about it, so definitely feel free to reach out to me personally.
Thank you, Dr. Silber. This is great. So thanks to Dr. Gelman. I feel like I went back to my public health master's program, and thanks to Dr. Silber, I feel like I went back to medical school. So there's so much to talk about, and you guys did such a great and comprehensive job. So thank you so much to the both of you. Now for a slightly different look at it in terms of human resources and employee relations. And so if you're an employee somewhere or an employer, this would affect you. So we now turn over the mic to Janet Gianetta, who's going to talk about human resources and COVID vaccine and in the era of COVID. So welcome, Janet.
Thank you. So this is very controversial right now. It's the question, can I or can't I, as an employer, mandate the vaccine? So, Jackson Lewis, which is a very well-respected law firm, recently did a webinar on this and said that right now there's no government law that requires employees to get a COVID-19 vaccine, but that may be possible in the future, especially to specific industries like healthcare. We've already seen that in the past, that skilled nursing, for example, Department of Health is dictated in the healthcare industry that you get like a flu shot, and it is required. But let's talk about just as a private employer. Can you or can't you? Vaccines in general, let's not talk about COVID, but can an employer require employees to get a vaccine because they're trying to comply perhaps with the OSHA's general duty clause? The answer is yes. Can they require a COVID vaccine? The answer is maybe, because there's a lot of considerations right now. Specifically, it's not clear because the vaccine is being offered under the emergency use authorization, because it's not fully approved by the FDA. As such, it's required that people are given notice that they have the right to refuse the vaccine. So the question comes, if I have the right to refuse, how can I be mandated? So it's very unclear in those situations. However, the right to refuse does not mean that there are no consequences for refusal. Bottom line is you really should tread carefully right now about mandating any type of COVID vaccine for a variety of reasons, not just the fact that it's under an EUA. One big thing is that there are laws that govern it. For example, the Equal Employment Opportunity Commission governs accommodations. An employee does have a right to say, because of religious reasons or health reasons, that I do not want to have the vaccine. As such, the employer has the duty to then enter into interactive dialogue and accommodate that request. And that accommodation can take a lot of phases. Could be that such as telework, such as is there another option? Continuing social distancing, masking. For example, with the flu vaccine, if somebody came and said, I can't have the flu vaccine in a nursing home, the option that an employee has is that they have to wear a mask at all times in any patient area or work area. So the question comes is, can I accommodate? Do I need to accommodate? And if there is a health issue, then you're also governed under the Americans with Disabilities Act, which considers is it a medical treatment or not. And there's also other laws of discriminatory, such as the Genetic Information Non-Discrimination Act, the Pregnancy Discrimination Act, private health information under HIPAA. So there's a lot of things that govern whether or not requiring somebody to have a vaccine and somebody's refusal to do so, does it violate any of these laws that protect an employee against discrimination? Now, those are federal laws. Keep in mind that in New York State, the Division of Human Rights has much, much broader guidelines with what actually determines, is it a discriminatory act and does it need to be accommodated? So these are all things to take into consideration as to, do we really want to mandate it at this time? Then let's go to cost. I know right now it's not costing to get the vaccine, but at some point it may. And so is an employer going to pay for that if it's mandated, which they should be? What about the availability? If I say I want to mandate it, can I have my employee actually get it? Can they get the second step? What if I can't get it? Am I going to be held responsible because it's not available? What if Dr. Silver talked about side effects? And even though right now, thank goodness, it seems to be very minimal, what if there is a side effect and I can't come to work because of that? If it's mandated and I can't come to work, are you going to pay me for that day or not? And then, of course, what if there are really serious side effects? What if, God forbid, there's a death or something that creates a permanent or partial disability? There's definitely questions as to whether or not that would fall under workers' comp. And is somebody then responsible because I mandated it as an employer? It was a requirement of the job. So those are all different issues that we need to consider. OSHA, of course, does have the general duty clause, and employees may want that to be mandated because they're going to feel that it's a safer environment. And do I have an obligation to my employees and also perhaps to my customers to make that a mandated vaccine? Other types of issues that can create concerns for an employer making this mandatory is that the National Labor Relations Act governs union and non-union employees and organizations, and allows for Section 7 terms for employees to band together about terms, benefits, and conditions of employment. So if I have a group of employees that don't want or do not want my employer to make this mandatory, that's a protected right under the National Labor Relations Act. So you can't take necessarily action against them without violating that. And again, that applies to union and non-union environments. But let's talk about a union environment. If you make a vaccine mandatory, it may be subject to collective bargaining. You need to look at that. Do you have to enter into that again before making it mandatory? There's also issues with discrimination and employment. If it's mandatory and I am now creating an environment that I am excluding a number of employees for disabilities, is that going to create any type of disparate impact or disparate treatment, which could have consequences? Also, of course, when you're talking about hiring employees, you cannot make this vaccine mandatory until after you have an offer of employment. So it can't be any type of a screening tool. So there's a lot of factors involved with whether or not you do or don't want to make this mandatory. I would definitely recommend a wait and see approach. I do think that we're going to see some things from some governmental agencies like the Department of Health, especially in certain industries, schools, healthcare. Also in New York State right now, there is a bill, assembly bill, that would make it mandatory if 70% or more people in New York don't get vaccinated. That's there. It hasn't been passed yet to my knowledge, but it's there. So I do think we may see some state or local laws requiring or not requiring these vaccines. So it's always something to keep in mind as to what do we do or not to do. The next question I get sometimes is, well, what if I do make it mandatory? You know, what do I do if an employee refuses? Well, again, you have to go back to why are they refusing? Are they refusing because of religious reason? Are they refusing because of a health reason? Is it protected under the New York State Division of Human Rights? Is it protected under Americans with Disabilities Act? And do I have to enter into an accommodation? And the answer is yes, if it does fall in that. But what if it's just, I'm scared, I don't want to do this? What can an employer do? Can I refuse, can I let them go? Well, that answer can be a yes, but I would challenge you to say, is that what you want? You know, it's definitely much more palatable, I think, for your employees to encourage it, to not make it mandatory. And there are things that you can do. There are incentives that you can do. You do have to be careful on that aspect too, because there's laws, there's tax consequences to incentives, especially if they're monetary. But there are things. There's also guidelines under the wellness rules. There's new wellness rules. How much can you make incentives? But many employers will go the route of incentivizing employees, encouraging them through education, through giving them time off to go get the vaccine, to perhaps having a raffle or maybe an additional day off if somebody gets vaccine. You just have to be careful that you're not going to violate somebody's private health information. And so everybody knows who did and didn't get the vaccine, because that's a problem as well. So there's a lot of things to consider right now with employers, employment. I'm talking about private employers right now. There's different guidelines, of course, with governments. Federal government's got constitutional employees, constitutional issues. But I've seen that definitely it's been upheld in different states for local and state employees that it can be mandated as well. But those are always going to be subject to a lot of different guidelines and rules, especially agreements and collective bargaining agreements. So for private employers, I would say slow the roll, hold off, wait, although there is a definite possibility that you can mandate it. It's not recommended right now. You're better off to do encouragement and take a look at accommodating anybody who needs to be accommodated. So I'm sure there's probably going to be questions at the kazoo about this, because there's never a one-size-fits-all answer to these kind of things. But there's a lot of unknowns out there and a lot of ambiguity still with regard to this vaccine. And, we have a new administration starting. We don't know what's going to happen, if there's going to be changes with that as well, with rollouts or guidelines with regard to this vaccine. So I would say take a wait-and-see approach, encourage your employees, be flexible, accommodate where you can accommodate, and hopefully it'll come out as a win-win situation for your employees and for yourselves. Thank you.
Thank you, Janet. That's great. Very, very helpful information. Boy, the HR stuff gets more and more complicated, doesn't it? But thank you for giving us that guidance. I know everybody appreciates it. And thank you to all our panelists. We now have a few minutes for some questions. Please post your questions in the chat. There's some additional supplemental information in the chat from Dr. Gelman and from Dr. Silber regarding the vaccine and some of the contact information and repeat doses as well. So Lynn, I don't know if you want to see if there's any questions or...
Sure, thank you. And thank you for everybody. And if anybody has any additional HR questions, they can contact Janet directly, and we'll post her contact information for you. But we do have a question. We have a lot of questions, so if I could just ask that the answers be somewhat condensed. So one of the questions is, what is the current definition of exposure in a work environment? And if someone is vaccinated, whether it's one or both shots, do they need to quarantine on exposure? So if you've been vaccinated and you're exposed in a work environment, do you still need to quarantine?
Yes, so the answer is yes, the short answer. And the reason for that is, and I was actually going to address it, after vaccinating, we're still wearing the mask, we're still avoiding crowds, we have not reached herd immunity. We all, going back to that Common Core question, 7 million qualified, but only 120,000 or so doses. We won't reach herd immunity for a while. That's precisely why we're still adhering to all quarantine and other parameters. As Dr. Silber mentioned, once you are fully vaccinated after your second dose, it's 100% effective from you having complications or you developing any issues meant for hospitalization or possibly even mortality. However, the actual chances of you contracting COVID-19 once you're exposed, it still leaves for that 5% potential where you may still propagate it, you may still pass it on to others. So as far as population health measures, keep in mind, isolation quarantine is a population health measure. And despite the CDC shortening that quarantine for 10 days, CDC still recommends that 14 days post-exposure is still the best possible scenario. They still recommend the 14 days as the safest option because the viral, the actual incubation period for the virus has not changed. It's still 2 to 14 days. So we have 10% of our positive individuals testing positive day 11, 12, 13. So yes, you will be vaccinated. Even if you contracted COVID months ago, you can still be vaccinated. However, socially, we have to adhere to all safety protocols and prevention protocols until majority of our population is immunized or has contracted the disease. So until we reach herd immunity. The answer is yes.
Okay, so given that, then what is the current, because I know this keeps
Yes.
changing, what
So
is the current definition of exposure? What
CDC
does that mean?
definition is less than 6 feet for longer than 10 minutes is the definition of exposure. But keep in mind, that's the definition for individual exposure. Anytime you're in a congregate environment, such as an employment setting, a work setting, a classroom setting, on a bus, anytime you're in a congregate living environment or working environment where individuals come across each other for hours, for a prolonged period of time, at times in a poorly ventilated area, those are all mitigating factors. So just because the definition of individual exposure is less than 6 feet longer than 10 minutes, that's just for individual cases. We will still isolate and quarantine individuals that are exposed. And by the way, isolation for individuals who are positive, that's 10 days. You test positive, you're under mandatory isolation. If you've been exposed, that's a quarantine, so that's quite different. But individuals will still be quarantined off in an employment or a congregate environment because that congregate setting is more of an exposure than the CDC guidelines allow for.
Okay. Dr. Silber, what happens if someone cannot get the second shot at the recommended 3 to 4 week time frame? You're muted.
Hi. So the recommendation is at 21, 28 days. You could do it as early. There's a 4-day grace period to get it early. If you are late, you do not have to repeat the dose. They do recommend getting it as soon as possible, but at this point, there is no recommendation, to repeat dosing.
Okay.
So get it when you can. If you don't have to start again. I was in the middle of typing too. And I realized I privately messaged the question back, but I just wanted to say that the mRNA does not enter into the nucleus, which is where we have our DNA. People worry about, they've heard rumors that it alters your DNA. Really, this RNA goes just into the cell, tells your body to make a protein, and just disappears after that. So there is no alteration of DNA. It really is just kind of a rumor. The protein that you need, that the body needs, they also said about infertility. There's a tiny bit of overlap of what the protein looks like, that you need something for pregnancy, but it's really has nothing to do with it. And so once again, that's just a rumor. So it does not alter your DNA. It doesn't cause infertility. And I just wanted to mention that. And I was typing it.
Thank you very much. I appreciate that, because I know there's a lot of concerns about, the vaccine, and are there any other, issues attached to it that may or may not be quite nefarious and questionable. So thank you for putting that all to rest. So I know we answered the question of where is registration done, and that's to call the health department, go on the website, the state website, and see if you're eligible. So the next question is, once you register and have your number, how do you get an appointment when everyone is full?
So I'm
Is
not
that-
sure what the number situation is. Typically when you register, so there's the check if I'm eligible tool, which just provides the providers in the area. Unless you have a date, time, and address of an appointment, you are not registered. So we have to make that very clear to all our residents that unless you have an appointment time and an address, you are not scheduled for an appointment. So I don't know what number they're alluding to. Perhaps it's in the screening tool, but that is just a reference tool to provide available providers in the area. Very, very important.
Okay, so you have to contact the provider itself or whatever's listed to go on those individual Department of Health. And I know the county executive has posted them and Cornerstone has them. You have to go through the provider to get the actual appointment.
Correct, yes.
Okay. All right, so now the next question is, I'm going to read it. It says, for private practices that are able to pre-book vaccines next week, how do you recommend counseling patients of that practice for time frame of being able to get through it at the office? We're getting notable feedback from patients for a desire to get the vaccine in their known doctor's offices. Is there anything specific that you would recommend as far as what a provider should be telling their patients?
I think Linda is raising her hand as far as providers. Obviously, until you have vaccine in hand, it would be counterintuitive to schedule those appointments and just notifying the patients about the availability. But I will leave that for Linda Muller, since that's exactly what they're doing.
Mm-hmm.
I don't know if she's able to unmute.
Yeah,
Linda, please unmute if you can.
She's trying. She's trying.
Just
Not for lack of trying.
All
there
right,
she
I'm
is.
on.
Hey.
I just got off of a hub call with Westchester Medical Center, and that question came up. We as providers need to be aware that we may not call our own patients. We certainly can look for patients who fit the criteria and are at the highest risk, but all of our numbers have to be opened up to the general community. That came up today from 2 very large private practices, and the state will not accept that. You cannot just vaccinate your own people. You have to have slots available. Patients need to be able to call. If they meet the criteria, they get an appointment. That's what the state said today, and they were pretty clear.
Thank you, Linda. Question about the waiting period after the second vaccine. Is there a waiting period? I know there's a waiting period between the first dose and the second dose. Is there a waiting period after the second dose before
As
it's
soon as
effective?
your symptoms resolve, so if the waiting period between vaccination is 21 days for Pfizer and 28 days for Moderna. If you've had COVID-19, you wait for your symptoms to resolve, as Dr. Silber mentioned, and 10 days or until your symptoms have resolved. You can get it immediately after, or the recommendation is within 90 days of clearing that infection.
I guess I wasn't clear. Once you have the vaccine, when does it become effective?
2 weeks after second dose.
Okay, thank you. Thank Dr. Gelman. I know has put a lot of information up here, as has Dr. Silver. We answered the rumors are that the vaccine changes your DNA. Is that true? That has pretty much been put to rest, that it doesn't really change, it just gives instructions. Is that correct, Dr. Silver?
Correct. It does not
Okay.
alter your DNA.
Okay, I see that Dr. Gelman has answered that. Dr. Gelman, if a person has a mask on but less than 6 feet and more than 10 minutes, is that still considered exposure?
As I mentioned, depending on the setting, it's very much setting dependent. If it's in a poorly ventilated area with a large number of individuals in a congregate setting, if it's for a prolonged period of time, if it's more than 10 minutes, but for instance, 4 hours, they may still fall under the quarantine precautions, because don't forget, it's not an N95 mask, which will actually filtrate those particles. It's a regular material mask that can still be open to particulate matter and still disperse particles if you're sneezing, if you're aerosolizing the particles. So it's very much situation dependent, even if you are wearing the mask, because we're preoccupied with population health and impact to others around you.
Okay, wonderful. Those are all of the questions that I have. I don't see anything else that's up here. Where do the pharmacies get the vaccine?
The pharmacies get them in the same place all of us do. It goes from the federal government allocation to the state DOH to the hub, and the hub redistributes it regionally. But if I could just address a couple of things, because these are just the questions that we're getting daily. Asymptomatic still means contagious. I know I hear a lot of individuals, but they're asymptomatic. But so what? They're asymptomatic. They're okay. You're still contagious if you're asymptomatic. You're not exhibiting symptoms, but you're still contagious. You can infect others. So that's a very important point. COVID vaccines will not give you COVID, as Dr. Silber mentioned. It's not an inactivated virus. It's not a dead virus. You're not getting the virus. You're getting the spike protein in the currently available vaccine. So no, it will not. COVID-19 vaccines will not cause you to test positive on a COVID-19 viral test. We're not having an increase because in positive cases because we're vaccinating. We're having an increase because of social gatherings around the holidays, and that's the aftermath that we're reeling from right now. People who have gotten sick with COVID may absolutely and should still get vaccinated in the parameters we mentioned. 10 days or symptom resolve within 90 days. So that's the parameters for getting vaccinated after you've had COVID-19. If you had monoclonal antibody therapy or anything along those lines, discuss it with your doctor because that may impact when you can obtain the vaccine. Getting vaccinated can help prevent getting sick with COVID, obviously, and we've mentioned the fact that the pregnancy impact, the DNA, also the variant. Everyone has been hearing about the UK mutation, the B117. There are 72 cases in the US, 4 in New York State. And now there's the South African mutation of coronavirus, and that's the 501YV2. The UK one, I know there has been some concern with both of those variants because they both impact the 501Y mutation, and it is a spike protein mutation. The vaccine impact, currently there's really no evidence to suggest that vaccine would not work because remember how vaccines work. They're just there to elicit your own circulating immune response, so you will still have some level of response. However, because it is on the spike protein, it remains to be seen if it will deactivate some of the efficacy. There is potential that it won't be, as we said, 96% effective from you contracting COVID-19, but it will still protect you from having that more severe case, being hospitalized or having that mortality that we discussed. So yes, there are mutations. There have been mutations all along since the original Wuhan strain. It just so happens that these two are more virulent, where we are seeing more individuals, they're more contagious because of that spike protein variability, and that's where it binds with the cell, so it's more likely to infect other individuals. But where it does pose some concern is to really see the long-term impact of vaccine. You will still have some protection from vaccine, but it may not be that 96%. It may be slightly less. It remains to be seen.
Okay. And I have one last question, and I believe it was touched on, but just for clarifications, can upstate residents get shots in New York City? This is
Yes.
statewide. We can go anywhere to get a shot.
Absolutely. And New York City has ample vaccine available. So if you can get that appointment, by all means, the sooner the better. Yes.
Okay.
Anywhere within New York State.
Well, that's the questions that we have. This has been extremely informative, really very informative, both from the logistic end of it, the medical, the HR perspective. So I want to thank all of our panelists, Drs. Gelman and Dr. Silber, and Janet Giannetta from HR Visions HR, for being on the panel, and Dr. Steyer, of course, for moderating this. This has been very, very, very helpful and very informative. I do know that also, and Linda, thank you so much for weighing in and sharing the information that you had. We very much appreciate it. And Linda and Janet are both on our board, so also thank you for your support of the chamber. I do know that Steve Newhouse, are you still on? There you are. So I don't know if there's anything that you want to just let everybody know from the counties.
I'll just say good morning. Obviously great remarks from everybody. And, Lynn and I talk every day, whether it's about the vaccine or how to help businesses. So if there's something out there that you need, any of the members, please don't sit on it. Make sure you reach out to Lynn, reach out to me. I talked to Linda Muller, Joan Cusack McGurk, all our team members for the vaccine. The situation is in layman's terms, if you have a map of the county, you have, and I'm going to put a map out, by the way, this afternoon, where the vaccines are being distributed at this current time, the hospitals, Cornerstone, Orange County. I'm at the 911 center right now. We're finishing giving up vaccinations to some people that signed up. We had a very limited amount this week. 200 doses we were given. Over 700 people signed up, plus another 1,000 in the queue. So it's literally a supply and demand issue for the getting the vaccine right now. Once that pipeline starts getting more robust, we'll see a little bit easier in the process. So I ask people to be patient, but if you have any problems, reach out to Lynn or I. The second thing, we got a new administration coming next week. I think you're going to have the best opportunities ever on some government spending, whether people like that or not. 86 projects that Lynn and I, the chamber, and I've been very, trying to work on for a long time. I think we'll have some good opportunities. In addition to that, it's a crazy time right now. We are on a very heightened alert in Orange County, as well as the state. And, there's a lot of crazy stuff going on. I think everybody's just got to take a deep breath. If you need anything, if there's an emergency or a concern, reach out to us. We've been on regular calls with the federal, FBI, state police. I have a call this afternoon with everybody together just to make sure we use our intelligence that have come into us, what to be aware of. But I do think that we're going to be fine. We just got to get through to next week. And again, I appreciate everything you guys do. And Lynn, thank you. And I obviously respect and our relationship and everything we're able to talk about. So that's all I got.
Thank you so much, Steve, and all the ditto to all of that. So I want to thank everybody for being on today. If you have any questions, of course, you can contact us. If you have questions about the new PPP draw, any of that, any of the EIDL, any of the loans, please do not hesitate to reach out to me. You can call me on my cell. Everybody else does, so you might as well too. And the number there is 845-551-9546. So I'll be more than happy. We assisted with over 300 PPP loans last time around. The other thing, just to let you know, is next month we will be having our two senators, new Senator Mike Martucci and Senator James Skoufis. And our legislative panel, we're not going to be doing the Senate and the Assembly people. It's just too many people for a Zoom meeting. But we will have the senators on. There's a ton of stuff, as Steve alluded to, going on in the state, much of which has to do with not-for-profits, where's their funding, new rules, new regulations, what's going on with businesses, what's happening with the unemployment premiums after that huge draw that we had last year. Janet's shaking her head. There's a bunch of HR things that are happening. The things have expired December 31st. So where are we going? That date will come out. We just want to make sure we don't conflict with session. So keep an eye on your email boxes and on our website and Facebook page. And please make sure that you are receiving our Monday, Wednesday, and Friday emails. And that's really all I have. I want to thank you all for being here. Don't forget, wear your masks, wash your hands, social distance, be safe. Dr. Steyer, thank you for all you do. Thank you for everybody for what you do to make this county the best place to live, work, dine, and all the good stuff. So stay safe and have a wonderful rest of Thursday.